Have a seat. Absolutely. Go ahead and get comfortable. My name is Dr. Perez. It's nice to meet you. I do apologize for us having to meet under these circumstances. I'd like to welcome you to the facility. Yeah. Of course, no, it's totally understandable. We'll kind of take things slow. Yes, of course. Okay. No, I totally understand. There's tissue here if you need it, and there's water there on the table if you need it as well, okay? Is there anything else I can get for you right now? Would you like something else to drink? You're okay. Okay, all right. Why don't we go ahead and get started with your intake? Is that okay? Yeah, okay. All right, dear. Well, as stated, my name is Dr. Perez. I am a clinical psychologist. You are welcome to call me Sarah or Dr. Sarah, whatever makes you feel more comfortable, okay? Okay. So, of course, we're here to do your intake paperwork and assessment. Yeah, okay. So there are a couple things that I just need to confirm with you before we can move on and get started with the intake assessment. Is that okay? Just a couple pieces of demographic information, confirming patient identification, that kind of thing, standard. Okay. All right, dear. Can you tell me your first and last name, please? And spell the last name for me. Yep. Fellow Sarah, nice to meet you. I love the way you spell your name. So that's C-E-R-A. Last name is Bellum. Sarah Bellum, beautiful name. Thank you for that. And of course, just confirming my name here. Can I have your age and date of birth, please? Perfect. Okay. All right. And when you did your pre-assessment intake with the nurse, it did say that you were on somewhat of a regular diet. Okay. Is that something you'd like to continue following while you're here? Okay. And just to confirm, your status is full code. So in the event of an emergency, we will be performing all of the necessary treatment for you. Okay. Thank you. Okay. Alrighty. Activity status, up ad lib, meaning you are up independently. You do not need any assistance from a person or assistive device. You're able to ambulate accordingly. Okay, thank you. Some of these seem like silly questions, just things that we need to confirm for your safety. Okay. Okay. And then just for your understanding, I do have you here for a complete psychological evaluation, as well as a neurological examination, which we will be performing secondary to this assessment. Okay. All right. Okay, so if we can go ahead and proceed with some demographic history. So these questions are just going to be pertaining to your personal life, nothing too invasive just yet, okay? Just answer honestly to the best of your ability. Okay. All right, can you tell me what your address is, residential address? Perfect. Road. Okay. And what is the zip code there? Okay. And what is your phone number? Perfect. Is that a mobile phone or is that a landline? Mobile. Okay. Can you tell me who you'd like your emergency contact person to be? So in the event of an emergency, who is your next of kin or person of your preference who you'd like us to call for you? Okay. And do you know their phone number by chance? And what is their relation to you? Okay. Thank you. Okay, so is this person aware that you are here and of the circumstance regarding your stay here? Okay. Would you like us to contact them on your behalf? Okay. And what information, if any, are you okay with us giving this person? Are you okay with us? Okay, so everything regarding your stay is okay to share with them. Should anything relevant come up, we will confirm with you once again before we relay any of that information with this person, okay? Of course, thank you. Okay. So just a couple questions about how you are able to sustain your lifestyle. So what do you do for a living, or what is your profession? Okay. Perfect. And how long have you been doing that? Okay, thank you. Are you comfortable sharing your current relationship status with me? Okay. And about how long has that been? Okay, thank you. Any known medical allergies? Allergies to medication, treatment, ointment, anything like that? No. Any known food allergies? Okay. And what symptoms do you attribute to that? Okay, so just a little itchiness, swelling of the gums. Okay. No shortness of breath, anaphylaxis, anything like that. Okay. Good. So I will notate that. Send it over to the kitchen. That way we don't accidentally contaminate any of your food, of course. Okay. All right, so let's go ahead and move on here. Okay. So the next few questions are a little bit about your medical history. Again, nothing too invasive just yet, okay? Okay. So are you currently taking any prescription medications? Yes, specifically that are prescribed to you. No. Okay. Are you taking any prescription medications that have not been prescribed to you? Okay. Do you smoke any tobacco products, or do you use anything containing tobacco, including vape? No. Okay. All right. Do you consume any alcoholic products? Drink? Nothing? Occasionally. Okay. How frequently would you say that is on a weekly basis? Okay. Perfect. Any recreational drug use? Mm-hmm. Okay. Okay, very good. Okay, so that will conclude our demographic history. Before we proceed with the mental health evaluation, I am going to go ahead and do a couple of things, okay? So I am going to place a blood pressure cuff on you, as well as an oxygen sensor, and all that's going to do is allow me to monitor your heart rate, respirations, and blood pressure as we proceed with the examination. Of course, these questions are fairly in-depth. They are very personal and can be triggering to some people. Obviously, for the purposes of your evaluation today, they are necessary and pertinent. I do, however, want to make sure we are not inducing any increased stress on you today, so it's important that I'm able to monitor those things for you, okay? Okay, so let me go ahead and get that. I will get it on you, and then we'll proceed. So for our blood pressure cuff, I'm just going to be using a wrist cuff, slightly more comfortable since we are in a more leisurely area of the hospital here. So what I'm going to do is just hand this to you. I'd like you to place it on your wrist, just like this, and just hit the button for me and it'll turn on by itself, okay? Yeah, okay. So I will give you that. Is that comfortable for you? Okay. All right, so the next thing is going to be our oxygen sensor. So this is a probe. Okay. And again, I'm just going to have you place this on your finger, just like this, and it will measure your oxygen as well as your heart rate, okay? Okay. So I'll give you this. Okay, thank you. And the last thing I'm going to do is, because you do have that allergy, is I'm going to place a wristband on your wrist, and this will just let us know that you do have an allergy. If any of the staff were to ask you what it is, you would just relay what your allergy is. Sometimes they do spot checks just to make sure that we have everything documented accordingly, okay? Okay, so if you'll just extend your wrist for me. Thank you. Is that comfortable? It's not too tight. Okay, perfect. Thank you very much. I appreciate the cooperation. And that wristband, of course, is waterproof, so you don't have to worry about getting it wet or anything. It will stay on for the remainder of your stay. Okay. All right, dear. So we are going to go ahead and move on to your mental health history evaluation. Now, this is going to cover both past and present. It is very important that you are as honest with me as possible. So I realize that this is uncomfortable for some people, and it can be embarrassing or feel shameful, anxiety inducing. I completely understand. I do need accurate information in order for us to be able to treat you appropriately, okay? So I sympathize with you, and I understand that the questions are difficult. If at any time you need to take a break, we can do that. You're welcome to have some water. Please let me know if you need tissue. We will get through them as smoothly as we can, okay? Okay, thank you. Okay, so first question. Any previous hospital stays, specifically at a psychiatric facility? Okay. So this is your first time. Any previous mental health diagnosis? So have you been diagnosed with anything specifically by a therapist, psychiatrist? No. Okay. Any self-diagnosis? Do you feel like there are any mental health diagnoses that suit you or that you feel like are appropriate to what you're experiencing? Okay, so you feel like you might have an anxiety disorder? And you've been pretty depressed lately? Okay. Okay. How severe would you say your current anxiety is then? Pretty bad. Okay. Like a 7 out of 10? Okay. How severe would you say the depression is right now? Okay. I'm sorry to hear that. Yeah. Okay, so we will come back to that, okay? Any history of self-harm? Okay. And is that recent at all? Okay. So the next few questions are regarding suicidal ideation as well as homicidal ideation, okay? So any history of suicidal ideation? Any thoughts of harming yourself or ending your life? Okay. Any current thoughts of suicidal ideation? Okay. Any history of homicidal ideation or thoughts of harming or ending someone else's life? No. Okay. Any current homicidal ideations? No. Okay. Thank you. Okay. Have you been experiencing any nightmares, either recently or in the past? Frequently. Okay. How many times a week would you say you have nightmares, bad dreams? 3 to 4? Okay. It's pretty frequently. Mm-hmm. Okay. Are you experiencing any of the following hallucinations or symptoms of hallucinations? So, are you seeing anything that other people are not seeing? Hearing anything that other people are not hearing? Or feeling anything that you know is not there or that you believe is not there, but you are feeling the sensation? And are there any physical symptoms that coincide with that? Any tremors, shaking? Okay. Nausea? Mm-hmm. Any vomiting with the nausea? Okay. Any sweating, shortness of breath, rapid breathing? Okay. Any loss of consciousness at any point? No. Okay. Good. Very good. Okay. How would you describe your current mental state? Cluttered. Okay, that's a good word. Mm-hmm. Pretty stressed. Okay. Mm-hmm. Okay. So you feel kind of like you're taking the steps to make the right choices, but things seem to just be not going right. Okay. Yeah, that can feel pretty defeating. Mm-hmm. Okay, so you feel like sometimes no matter what you do, things just don't go the way that you think they should. Okay. All right, thank you for sharing that. Okay. Are you experiencing any sensitivity to light or sounds? Not usually. Sometimes if you have a headache. Okay. Mm-hmm. Okay. Any trouble getting to sleep, staying asleep, falling asleep? You feel like you have trouble waking up. Okay. So you're able to fall asleep, but you feel like you need a lot of sleep lately. Okay. About how many hours of sleep are you getting on average? 10 to 11, so quite a bit of sleep, but you feel tired most of the time. Okay. Mm-hmm. Okay. Okay. I see. Okay. And you feel like that expels a lot of your energy? Yeah. Okay. All right. Well, I appreciate you for being open with me. Yes, it's important that we have an honest relationship so that I can treat you as best as possible. Absolutely. Okay. Okay, so the good news is we have completed our mental health assessment, and I think at this time it would be a good idea to medicate you. So it is coming into evening time. We do still have the physical portion of our examination that we will complete. I would like to get your anxiety level down just a little bit. Is that okay with you? Yeah. Just kind of settle things just a little bit. So we're not doing a whole lot this evening. Once we complete this portion of the examination, I will be doing a brief neurological examination, testing some of your cranial nerves, just making sure that your basic senses are working. Afterwards, we will go over your behavior contract, which is standard for all patients, as well as your intake form that I will have you sign. You are being voluntarily committed, but you will still be placed on a hold. That is protocol. Okay. Okay, so I do have a couple very standard medications here for you to take, and one of them actually is just, I'm sorry, two of them are just natural supplements that will help you get to sleep tonight, okay? Okay. All right, so let me go ahead and dose those out for you. So I just have a medicine cup here. And this is your medication. I will be storing it with the nurse, and they will proceed with your dosages from this point forward, okay? Okay. All right, so just to let you know what they are. So the yellow tab is melatonin. So I'm sure you've heard of melatonin. It's a naturally produced chemical that helps us get to sleep. So I have a very small dose, 5 milligrams of melatonin in here for you, as well as the 2 white pills, which are magnesium. Again, just another naturally produced supplement that will help you stay asleep. The red pill is Ativan. So that is an anxiety medication. Have you taken that before? You have. Okay. Yeah. So low dose, just to get you a little bit calmer for now. Okay? Okay. So you have water there. Perfect. Okay. All right. So I'll give you a second to go ahead and consume those. Perfect. And if you are comfortable, we can then proceed with our physical examination. Essentially, all that is going to consist of is me having a brief inspection of your face, having a look at your eyes, checking for pupillary constriction and dilation, essentially just how your pupils move in comparison to the light. I will also test your visual acuity. Because you'll be in group therapies as well as individual therapies, and there will be paperwork and pamphlets that are handed out. I just want to make sure that you are able to read all of that appropriately without assistance, as well as testing your color blindness, testing your color vision, of course, again, to go with some of the therapies that we have set up for you. Okay. I'll be doing a couple tests of your peripheral vision, which is just standard ocular motor test there. Having a very brief look in your ears, very brief test of your hearing. Again, we want to make sure that you will be able to safely participate in your therapies. Okay. All right. Of course, a visual inspection just of your extremities, just to have a look at some of that self-harm that you were talking about. Okay. Okay, so I think actually now what we can do before we proceed with your physical examination, as it is getting late into the evening, let's go ahead and go over our facility guidelines as well as your behavioral contract, and then we will end with our physical examination, okay? Okay. Alrighty, so for our facility guidelines, all of this will be lined out to you in your behavioral contract, which I will have you sign in the morning, but I want to go over everything with you now, okay? Okay, so as stated, you will be placed on a 72-hour hold. After the 72 hours is over, we will reassess. But in the meantime, you are not permitted to leave the facility, okay? Okay. So tonight, if you would like, you are allowed 1 phone call on your personal phone, after which time your cell phone will be turned into our lockbox. So you will have your own personal lockbox where we will lock any contraband that is not allowed within the facility walls, okay? Okay, so after your 1 phone call, you will not be permitted any phone calls to family or friends until your hold is over, at which point we will reassess, and if your hold is extended or if you are not placed on a hold but you're voluntarily staying to continue with your therapies, you will be permitted 1 phone call a day on the phones that are located in our call room, okay? Of course, all calls are monitored. Yeah, just for your safety. Okay. Okay. Yep, there's a camera in the room, so there won't be a person in the room with you, just to give you a sense of privacy, but there is a camera in the room with audio feeds where they can monitor. Okay. All right, so we have a zero tolerance policy for the following materials. Okay, so no drugs unless prescription provided from us, and they will be kept locked away with the nurse. You will go to the med line every morning and every evening, and your meds will be handed to you. Okay. No alcohol or illicit drugs. Okay. No pornography or otherwise sexual materials. Okay. Of course, no weapons of any kind, as well as no sharps such as needles, razors. Okay. No aerosols, so no hairspray, air freshener, anything that's in an aerosol can, as well as no lighters or other flammable materials. Okay, so no matches, anything like that. Okay. No strings, belts, scarves, shoelaces, any kind of material that can be used in a dangerous manner. Okay. Yes, so you will be able to keep your shoes. We will just remove the shoelaces. We do have shoes and clothing that we will also provide you with if you're more comfortable in that. We will have to take the belt loop out and that kind of stuff, okay? Some people tend to prefer our clothing simply because it doesn't have things removed from it. It's made to be safe for you, but it is your choice. Once your clothes have been modified, you are able to wear them if that's what you choose, okay? All right. So we will be requiring a daily urine sample, so you'll be provided with a cup. Your first sample will be tonight, so I will give you this urine cup after we finish with our examination. You'll provide me with a sample, and then every morning when you get in the med line, the nurse will give you a cup and you'll provide a sample again, okay? All right. So vital signs are taken Q4 hours, and that is around the clock. So we do have night shift medical staff. They'll come in, wake you up, take your vitals, go back to sleep, and that will be every 4 hours. So for night shift, that's 12:04, 8 a.m., and then 12:04 p.m. Okay. 8 a.m. medicine call, so you do need to be up by 8 a.m. to have your medicine taken on time, okay? Okay. Meals are scheduled, group therapies are scheduled, and your individual therapies will also be scheduled. So once your intake is done tomorrow and we get you settled in a little bit, day one is a little bit different. Afterwards, you will be given an itinerary that has your daily schedule on it. Okay. Absolutely no surprises. We want you to feel prepared for the day. We don't want to spring anything on you. So the daily schedule will be printed outside your door in the morning. You can grab it and have a look at it and be prepared for what's going on that day, okay? Okay, perfect. All right, so we are all done with the paperwork side of things, okay? Yeah. Let's go ahead and move on to your physical examination. Okay. So I have my tray here. I'm just gonna come a little bit closer to you and we can begin. Okay. Okay. Are you comfortable? Okay, so I'm a little close to you. There will be portions of the examination where I need to come closer. Okay, of course, let me know if it makes you uncomfortable. All right, dear, let's go ahead and get started, okay? So the first thing I'm going to do is just start with a basic visual inspection of your face. So just looking for anything abnormal. Obviously, no one is perfectly symmetrical, so just looking to see if there are any more obvious deformities of your face or anything that could be a cause of concern, okay? Okay, so just relax for me. Just gonna have a look at you as a whole. So looking at the structure of your face as well as your skeletal structure. Looking for placement of your eyes as well as your nose in comparison to your mouth. Okay. So also looking at your posture. And I'm not seeing anything abnormal. You appear well groomed, well taken care of for the most part, okay? Okay. All right. Okay, so let's just go ahead and move on to a couple of palpations of your face. Now, I am not going to wear gloves for this examination as I'm just touching your face. My hands are clean. Okay. So I'm just going to be using my hands to kind of gently feel around, mainly around your eyes, a little bit around your sinuses. Okay. you can just close your eyes for me so that I don't accidentally poke you. So I'm just going to begin by feeling for any weakening of the muscle tone here. So just kind of very gently feeling around this area. Any pain or discomfort here? Feels okay. And here it feels okay as well. This is fine. Okay. If I feel here, does that feel okay? Any pain or pressure here, sinus pressure, or congestion, do you feel okay there as well? Okay. And here. Okay. Alright, so that looks okay so far. Yep. Just gonna jot that down, okay? Perfect. Alright. So let's go ahead and move on to a couple tests for your eyes. Okay. So I have a pen light here, just a standard pen light. It's fairly bright. I'm just going to be doing a test of your pupillary constriction and dilation. First, I'm just going to shine my light in your eyes and just have a look to see if there's anything abnormal going on. It's very bright. I want you to try to look ahead. You can look at my nose. Just try not to look directly in the light, okay? Okay. So I'm going to start by bringing my light in slowly and just having a look in your eyes. So far everything looks relatively normal. So what I'd like to do now is just go ahead and test that constriction and dilation that I was explaining earlier, okay? Okay. So I'm going to be moving very close to your face. Okay. Now just relax for me, eyes open. And the light is coming in. So essentially what I'm testing now is when I bring the light in, your pupil should constrict, and I should see a corresponding response on the other side. Good. So I have a little card here, so if I occlude one side and then bring my light in, I can test your eye individually. And then when I remove the card, I see that there's no response there. Okay. I'm going to do the same thing on the other side. So, occluding this side, bringing in, bringing the light in. Testing that as well. Okay. And good job. And perfect. Okay. Give you just a second because I need that for water. Okay. Good. So, since we are checking your eyes, I'm going to go ahead and go in with my Ophthalmoscope. So just this tool here. So this is an ophthalmoscope, and it's a little bit cumbersome to put together, but it's actually just going to be having a look inside your eyes now, okay? So it just allows me to change the setting slightly so that I can have a look at the interior of your eye. So I'm going to be coming very, very close to your face for just a few seconds, okay? Yeah. So I'd like you to just turn your head very slightly. Okay. Alright, so just having a look in your eye. And I'm going to be adjusting this here so that I can get a bit of a better look. Perfect, okay. Yeah. Looks pretty good, I think. Not seeing anything concerning on that side. Now look in the other eye, okay? Just perfect. Okay. Again, just having a look here. That looks good. Good visualization there. Okay. Now, since I have this here, I'm going to do a brief test of your ears. So just gonna have a peek inside, okay? So same thing. This is the otoscope here, and I'm just going to be placing this inside your ear. Doesn't go in very far, so just to about this point. Just allows me to kind of look inside, see if anything's going on in there, okay? So again, if I can just have you turn for me. Okay, so I have good visualization. I am just going to very gently pull up and back on your ear here. And I'm able to visualize your tympanic membrane, which is great. So normal in color, kind of a pearly grayish color. I'm not seeing any occlusions or any abnormalities in your cerumen, which is good. So earwax appears healthy and nothing to worry about there. So I'm gonna go ahead and take it out, okay? Okay, you okay? So let's do the other side. Okay. Going in and perfect, okay. So once again, tympanic membrane is visualized and pearly gray in color, no signs of tear or any other abnormalities. Cerumen is normal color and texture, does not appear to be impacted at all. Good, okay. Your ears look great. Look at this. Okay, so just allow me to put this back. Alright, you are doing great. Now that we are done with the light test, I am going to test your visual acuity, okay? So, testing your visual acuity essentially means that I am testing your ability to see and read at a certain distance. So there's an average distance that most adults are able to see at, what is considered within normal limits of vision. So I'm just using a Snellen chart here. So this is a pocket chart because when I'm closer to you, it's going to scale. Okay. So I have, let's see, I don't see my pointer tool, so I guess I'll use my pen. Okay. So I'm just going to be using my pen to point to the letters, and I'd like you to just read them aloud for me. Okay? Okay. Can you see this okay? Okay. I think it's going to read for me this letter here. Good. And here. And here. Mm-hmm. Perfect. Perfect. You're doing great. Mm-hmm. Good. Okay, so you did well with bullets. Now, can you tell me what color this is here? And what color is this here? Green. Good. Okay. So what I'd like to do now is something similar. I'm going to hand you an ocular occluder, which is just this handy device that looks like a pair of sunglasses. And I'm going to go ahead and open the little window here. Now I'd like you to hold this up to your face for me, starting on whichever side you prefer. I'll have you read a couple letters on the Snellen chart and then we'll switch sides, okay? So this is just testing to see if one of your eyes is stronger than the other. Okay, so you go ahead and hold that up for me. Perfect, just like that. And just gonna go over a couple of the letters. So can you see this here? Good. And this here? And can you read the lowest line? H? Good job. Okay, so switch eyes for me. Yep, so can you see this letter here? Yep, and this one here? And again, can you read the lowest line for me? H. And can you read this line backwards? So, perfect. And again, what is this color? Green. Good. My favorite color. Yes, thank you very much for that. You're doing really well, and we are almost done. Okay? It's getting a little late. I'm sure you're tired. Is that medication helping you at all? You feel it a little bit? Okay. Calming down just a little bit. Good. All right. Let me just take a quick note here, okay? Mm-hmm. Okay. So what I'm going to do now is a very brief test for color blindness. So this is an Ishihara test book. Essentially, it just has a bunch of different color plates on it. So circles with colors in them. I'm going to point to them. I'd like you to just indicate what you see. Okay? No tricks. So this first one is actually just a test. So you should be able to see a number here. 12. Good. Okay. So can you see anything here? And on this side? Perfect. Okay. See anything here? And here. Getting a little harder. You see anything here? And here. Okay. Alright, so we're going to skip ahead here. Do you see anything here? 16. And do you see anything here? So you see a pattern but not a number. Good job. Okay, so for our last one, do you see anything here? 35. And then I'd like you to trace here for me. So if you see a pattern, trace that with your finger. Okay, so you are not colorblind, which I'm sure you would have known prior to today, but of course it's good to test. So you did great. We are flying through your test here. And the next test I'm going to perform is a follow the light test. So essentially at this point I'm checking to see if your peripheral vision is up to par here, okay? So I have a little bit of a different light here, kind of looks like a little flashlight. And I would like you to keep your head midline for me, so do not move your head. And just follow the light if you can with just your eyes, okay? So head midline, yeah. And follow the light with just your eyes. Mm-hmm. You're doing good. Yep. And if I bring it out a little bit and back in a little bit. Good. Okay, so I want you to look at the light and now look at my finger. Again, look at the light and look at my finger. Good. So here, look at my finger. And now look at the light. And look at the light. And at my finger. And then look at the light. Good. Okay. Alright, so continuing with testing your peripheral vision, I'd like you to keep your head midline. I'm going to move my hands into your field of vision at various angles, and I'd like you to just indicate when you can see my fingers, okay? So you'll just say yes. Okay. You should not be able to see them here. Say yes when you can see them. Good. 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 Good job. And here. And now I'd just like you to indicate which side you see. So I'm going to be moving my fingers, and I'd like you to just say left or right side, which side is moving, okay? Great. We did great. So no issues with your peripheral vision. Okay. All right, so let's go ahead and move on to a very brief hearing test. Essentially just testing the basic functions of your hearing. Of course, you're able to hear me appropriately, so I don't foresee you having any difficulties with this test, okay? So I'm going to have you close your eyes for me, and I'm just going to be making a very slight sound, and I'd like you to just indicate if and when you hear it, okay? Okay. So, eyes closed. Good. Good job. So alternating that sound just a little bit, I have a thermometer probe cover here. So I'm just going to be making a slight crinkling sound. Can you hear that? Good. So I'm going to use this to test your directional hearing. I'm going to move it around your head, just like this. And I want you to tell me what side it starts on and what side it ends on. So for example, here, I'm starting, ending here. Okay? Good. 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 Perfect. Good job. Okay. And both sides that time. Good job. Tried to trick you, but you caught me. Okay. All right. So the last portion of your examination is going to involve me just having a very brief look at your extremities, okay? Yeah. So I just want to have a look at your arms as well as your legs. Yeah. I know. It can be difficult. There's a sense of shame that comes with it, and I understand that. Yeah. No judgment from me. It's simply for your safety. So from a medical standpoint, I'm just having a look to see level of healing, if you need any wound therapy treatment and that kind of thing, okay? Okay. So I'll just see various things for me. Okay. So just having a look, and I'm actually going to use my light here, okay? Okay. So just having a bit of a look here. Does appear to be mostly healed. Okay. The other side. Alright, so I don't think you'll need any wound therapy treatment. It does appear to have mostly healed. And the more recent markings here are scabbed over. So just allow those scabs to heal. Your body is kind of producing a natural barrier there that is healing the skin, so we'll just leave it alone. Okay. Just gonna have a look at your thighs. Okay. Alright, so just having a look at the skin integrity here, and most of this does appear to be healed. None of these look reset. Yeah. Okay. Good. Alright. Alright, well that is it for our examination. Thank you for allowing me to have a look at this thing. I appreciate it. Yeah. Of course. So I have an open door policy. I do leave at about 9 p.m. But of course there is a night shift psychologist on the schedule. There's also several nurses as well as the med techs and several other medical staff that's here for you, okay? So should you need an emergency session, you can use your call light. You can also call your night shift psychologist if you feel like you need a session and it's kind of pertinent for you, okay? Scheduled therapies will resume in the morning. Of course, we're kind of getting you settled in. And as I stated, intake day is a little bit different. So for tonight, I'd like you to just kind of try to relax. I know that sounds like an oxymoron, relaxing in a psych hospital, but it is important that you allow your mind to rest as much as possible, okay? Stay hydrated, drink your water. Yeah. You feel like the Ativan helped you quite a bit. I'm sure you're pretty tired. Okay. Well, you have kind of a long day ahead of you tomorrow and an 8 a.m. wake up, so they will be coming in and taking your vital signs Q4 hours as stated, so you have about 3 hours before they come in and get your vital signs again, okay? All right. Okay. So you can go ahead and go back to your room and try to get a little bit of sleep if you can, okay? Okay. All right, dear. Okay, well, I will see you in the morning. Okay.